Hello everyone, I'm Yiyun Liang from Northeastern University. I'm going to give the ranking of hospital based on HCAHPS patient satisfaction survey. So as we all know, patient satisfaction is an important and commonly used indicator for measuring the quality in healthcare. But you can't help wondering, why should we care? Why should anyone care about patient satisfaction? I mean, hospitals never lose business as long as they can cure people. And obviously, that's the main responsibility of a hospital, to cure people. So basically, for a hospital, all they need to care about is the technique of the doctor, right? But still, let me remind you the horrible experience in the dentist. Uh, well, do you still remember the morning background in the waiting room, the bloody sink, and don't forget the horrible Dr. Doom with a drill that can go zing in your mouth. I went to a dentist a few years ago, and after they fixed my bad tooth, they kind of forced me to do one ultrasonic teeth clean. I mean, they already told me that I have really sensitive gum, and they gave me one anyway. You see, can you imagine a doctor with a tube and the ultrasonic buds are all around your ears and the blood from my gum that's sprayed all over the place? I mean, I after the cleanness, I use a tissue to wipe my face and it turn red with my blood. So, well, you can see I'm never going back to that dentist ever again, and you can certainly see that patient satisfaction is important for both hospitals and patients. Hospital needs to show the community that they're interested in quality care and they need to find a way to improve in order to remain competitive. And for patient, I mean, many people will even hold their pain to avoid to go to dentist. That's a big issue, right? So that's why we need to improve the patient satisfaction for both hospital and patient. And about the patient satisfaction survey, I mean, I didn't do the survey myself, but I just wanted to give some compliments to the one that I've chosen. I'm using HCAHPS survey. HCAHPS stands for Hospital Consumer Assessment of Healthcare Providers and Systems. It is the first national standardized publicity reported survey of patients' perspectives of healthcare. Hospitals. There are three broad goals that have shaped HCAHPS. First, the survey is designed to produce data about patients' perspectives of care that allow objective and meaningful comparisons of hospitals on topics that are important to consumers. And second, public reporting of the survey results creates new incentive for hospitals to improve quality of care. And third, public reporting serves to enhance accountability in healthcare by increasing transparency of the quality of hospital care provided in return for the public investment. With these goals in mind, the Centers of Medicare and Medicaid Service and the HCAHPS project team have taken substantial steps to assure that the survey is credible, useful, and practical. And here's the perspective of the surveys covered. It covered rooms, staff, operations, and information transparency. Well, let's see those perspectives based on the question they have in the survey. You see the covered room cleanness. The room is always clean, never clean, or usually clean. And the communication skills of the nurses, communication skill of the doctor, and communication from the staff. If they give help or not. Where's the room? Where's the doctor? Right? And if the pain control well, of course, what medicine am I taking? What is doing? And what is side effect? I need to know that before I take any medicine. Right? And discharge information. After I go home, what should I do? What should I, what if I still feel the pain? And overall rating from the patient, what does they think? And quietness of the room perspective, and willingness to recommend. Are you gonna recommend this hospital to other patients? Well, you see, to give ratings to is to combine the score of all the features. But since they are all different features, I did a little research to value them. First, about the room cleanness and quietness. Clean bathroom and patient rooms can help prevent the spread of bacteria and the virus that can cause illness and serious complications. A higher score may indicate that the hospital provides a higher level of patient care. And the research that did by University Medicare Center of Princeton that shows that patient care is linked to room cleanliness and quietness. So before the patient was shifting to the new rooms, new facility, the room cleanliness sort of stuff, and the hospital, created a model of new rooms and ran tests comparing patient satisfaction scores from patients in the old rooms and patients in the new rooms. So even though all patients gave the same nursing care and ate the same food, the ones in the newest room rated this aspect more favorably than the ones in the old room did. They allowed the cleaner and the quiet and more quiet rooms, obviously. And there's another fun positive change. Patients in the new room need 30% less pain medication than the old room patients. So, and right now they shift all the patients in the new room, and the hospital patient satisfaction ranked higher than ever before. So in that case, you can see that the room cleanliness is a big issue in the patient in the patient satisfaction care, and that's why I gave room cleanliness 10 points and room quietness also 10 points. I also the communication skill. Communication is the key for patient satisfaction. We must acknowledge our patients' feelings and concerns and let them know that we understand and are actively paying attention to both their verbal and nonverbal language. Let's see, on the surface, communication appears to be a simple concept within healthcare. Patients talk to doctors, nurses, and staff members. Doctors explain treatment options to patients. And so that's why I give patient, nurse communication skill 13 points, and doctor communication skill 12 points, and staff communication skill 10 points. And about the difference between these three, nurses are the backbone of any healthcare institute and are the face of the daily care that patients receive. So patients tend to have the most interact with the nurses. That's why I give them the most points, 13 points. And for the doctor's communication and interpersonal skill encompass the ability to gather information in order to facilitate accurate diagnosis uh, and give therapeutic instructions and establish caring relationship with patient. So, and that's why I give doctors, it's more important. That's why I gave them like 12 points on their communication skills. And patients, interact with the staff mostly like they're asking about where to go and what to do. And that's also important in the hospital because if you come out of the room and you have to go to to test something else and you don't know where to go and you have to ask, right? Otherwise it's time consuming. So that's important too, and that's a big aspect in patient satisfaction care. So that's why I gave him 10 points. Again, about the pain control. So if patients need medical care for pain during their hospital stay, the survey asks how often their pain was well controlled. Well controlled means the hospital staff did everything they could to help patients with their pain. So, but there's a fun research done by International Associate for the Study of Pain on influence of expectation and the actual pain experience on satisfaction with post-operative pain management. So, there's a fun fact. The research shows that 53% of patients who have previously undergo surgical procedure claim to have experienced moderate or severe pain at that time. Current pain prior to the present surgical procedure was reported by 61% of the patients. Most patients, like 91%, expect the pain of moderate to severe system, and 76% reported to have experienced such pain level. And in spite of this, 91% of patients claim to have, the 91% of the patients have severe pain, but only 81% of these patients claim to, not, 81% of the patients claim to be satisfied with the pain control, pain management, and only 8%, I say, is dissatisfied. So even though there is this pain control is a severe problem in the patient satisfaction, but the patient seems to have low expectation on this. They seem to, know that they will have severe pain after the surgery, and that is true. But they cannot tell what level they have, and is that the correct level, and is that really they are doing the best they can to control their pain. They can't really tell that. So that's why I've given the pain control as 5 points, because the patient cannot really give the specific feelings of this aspect. And the information about the medicine, which is the information transparency, explained means that hospital staff told that the medicine was for and what side effects it might have before they gave it to the patient. So, because of the potential for drug interaction and the side effects, it is very important that patients and staff communicate about medicines, what they are for and what they could interact with, and what the side effects patient could look out for and report. So it is really an important perspective, and that's why I gave them 10 points. And for the discharge information, well, basically the instruction when they go home, patients reported whether hospital staff and had discussed the help they could need at home. Patients also reported whether they were given written information about symptoms or health problems to watch for during their recovery. Well, that's what discharge information is. And then so a patient may feel rushed or not ready to leave if she or he still feels sick or in pain, doesn't understand his or her illness, doesn't feel capable of self-care, hasn't recently seen a physician, feels that his or her illness warrants a longer stay. So patients may also disaffections with the discharge process if the hospital discharge procedure, like I said, is too rush. And so that's why patients need guide in their home to, cure them. They can't really fully cure in the hospital after the procedure. The hospital won't allow them to stay that long, in a room, on the hospital bed. They can really do that at home, but they will really feel rushed out if they don't give them, informations on. Is it normal that I'm still feeling pain? Is it normal that I'm doing this? I eat this, right? So that is an important issue in the patient satisfaction, and that's why I give him 10 points. So about the overall ratings of the hospital and the willingness to recommend the hospital, that sounds to me as the main point of the rating. You see, I'm rating the hospital by the patient satisfaction, and if the patient satisfied with the hospital, they will give higher rating, and that's why I give them contest 25 points on each, because they are the whole point of the ranking. So okay, let's see the data. And the data preparation, I didn't really get the raw data from the HCAPs. They already cleaned them up a little bit, and the thing is, I have to measure all these questions and give them an overall ratings. So the technique I'm using to do that is MapReduce. See, this is my MapReduce code, and well, the first time they get in, they will output the last one and get the number of percentage of the question from an array and output to the reduce. Well, because I was going to do that in the reduce, but because the reduce is recursive, so you couldn't really do the job. So I give all this to the mapping, and you see here is the overall rating, and when they go into the question, they can filter the question and get the percentage and count the ratings based on the marks I just told you. And here is here is the marks I'm giving them. You see, I'm giving them 4 marks if they choose that is like the room is always clean. I get the information from the doctor. The communication skill is pretty well, and when they are normal, like the room is normal clean, the communication is okay, and well, in that case, I give them a half mark. Like here, 5 points for usually clean, usually get help. And if they don't get, like, no, I don't have information on discharge at all, I don't give any marks on that. So you can see there's no such thing as I don't get no, I don't get information. So that came an output of this, which can show better in this one. So you can here you can see we have more than 4,600 hospital here, which is a lot. And I cleaned those questions like this. The clean room. You see, this is the ranking on the. This is the first one that give the highest marks ever. You see, there's like 97% of the people feel the room is really clean, and 100%, 99% is doing really well. And you see, I've already given you the preparation, and you see I'm using Tableau to give the reporting of the ranking. See, this is the overall ranking of the hospital. You can see the provider ID, state, city, and from this, you can see Westlake Regional Hospital. It's a perfect one. Let's just move to Columbia, right? And for the cities, you see, for every cities, let's find a more easy one. So Phoenix, and this one, Mayo Clinic Hospital is the best hospital in Phoenix. So that's why you can see, let's find Boston. Boston is New England. Baptist Hospital. We never heard of that, but well, it's the best. Well, you can see that, and group in state. From the state, you can see which one is the best. For Alaska is this one, Peninsula Hospital. Okay, and let's still see California, and it's Santa something Valley Cottage Hospital. Okay then. Well, you can see the ranking by the state, and here is ranking by the city. And for every city, there's the best one you can see from here, and also the rankings by the. But there's one in every city, so you don't see any duplicate, right? That'll be doomed. Well, see the rankings, I mean, for the hospital report based on the patient satisfaction is complete. And after comparing with the official data from the Health Insight website. You see, I already opened one. Delaware. Oh yeah, they're ranking by the state, so I can show you by the state. You see, yeah, I just saw this, and you can compare these two. Compare mine and the official one. See, the first one is Christiana Care Health Service Company, and oh yeah, this is a little, but well, it's not a big issue, right? They're still in the second and the third. Just also the data is not the same thing. Mine is September, theirs July, so maybe they did something to upper their patient satisfaction, maybe, right? And for their base, right? Saint Francis Hospital, and I'm losing one. I don't know. There's no such hospital in the table for me, and we can see another one. This one I'm already showing, and let's see. Yes, this is the HCAPS, and let's see. Alaska is first one. See their ranking, and from my hospital, Alaska. Yes. See, it's rating by the numbers of their mark, and the SAS Peninsula Hospital, Providence, Korea, and Ferris. Oh yeah, there's a little missing. The third one, the fourth. But it's okay. They might done something in the 2 months. Okay. You see, it's like 80% accurate. I mean, not accurate. 80% alike the data they provide, and well, I see. So that's what I did. The ranking of the hospital, and it's complete. Thank you very much. And well, it's and Chicago is the better way to go, because I don't know why they give the higher ranking overall for the hospitals in there. So thank you very much. And well, if this is a live presentation, I will give you a question and answer, but it is not. So thank you and goodbye.